My name's Katina Hardy and I'm in conversation with Rebecca Lim, who is an amazing humanitarian that's been working with people from refugee backgrounds and people seeking asylum. Rebecca, 26th of June, and we're in the midst of a global pandemic with COVID-19, which has seen lots of things change throughout the world and the way we live our lives. Really interested to hear your experiences of how it's affected the people that you work with in terms of people seeking refuge and asylum seekers.
So at the Interpellion Uniting Church Refugee and Asylum Seeker Support Hub, we, during these difficult times, have been helping the people on bridging visas, and some of them have no visas. We call them I guess this is the legacy caseload people who arrived by boat after 13th of August 2012, who are subject to the fast track assessment,
which you were talking about,
which I was talking about earlier.
Yeah.
Quite adversely affected actually, because it's the assessment is kind of not, I think, legally sound. So many of them would have work rights but have lost their work, their jobs due to COVID, and are not entitled to job seeker, job keeper payments, that kind of thing. So there's a lot of angst and grief and sadness and stress because of there's no income.
Right.
There's very little support. The Queensland government has brokered a deal under the ASTRA funding, which is really quite good. It's funding from the Queensland government, and I think other states may have started to follow suit. So you get very limited income support, albeit limited, but albeit at least something that can help people to pay for their rent. And so they come to the IUC hub. We provide them with emergency relief, a supermarket voucher once a month. They can get food weekly. And those who've been fortunate enough to maintain their jobs have maintained their jobs. Maybe some hours have been cut, and others have lost their jobs totally, and others don't have work rights. So there's also community support, not just the IUC hub, but we've got lots of donors who've either donated groceries to us or give us money where we can buy supermarket vouchers, and we get food from different sources.
Because the IUC hub has no funding, does it?
We have no funding. We're all volunteers. I mean, we have donations kind of thing. We're not funded by anyone. No. The ASTRA funding is to fund agencies to use us as a hub, as a meeting point for people to come and then access the services. Include legal support from rails.
Right. So things like the food that you distribute is primarily food that's been donated either through funding that you've received, so private donations.
That's right.
Or, people like the volunteers bringing food in and things like that.
Yes. Yeah. And also through food bank.
Yes.
So we are able to go to food bank and we've got there's a lot of goodwill and generosity in the community.
Yes.
As always, the responsibility falls on the community. In times, when things are difficult, government abrogates the responsibility. But the Queensland government, top marks, they've also got some funding for homelessness. So anyone who's, the Premier has kind of said, I don't want anyone on the street, I want people off the street, homeless people off the street. Because that's because of COVID. That's
irrespective of whether they've got a visa.
Regardless of their visa status, if you're a citizen, you're a migrant, you've got no visa. So that's funding for homeless people.
Fantastic.
Which is really, really good.
Yes.
So we kind of refer on if we kind of need it.
Yes. Okay.
So I guess the stress is compounded because of their visa status. They're going through the courts.
Yeah.
Because they failed the fast track, so they're going through the courts, or they're at the end of the road, and we're helping them to write submission to the minister for the minister's consideration to lift the bar to allow them to make another protection visa application.
Okay. What happens to them if they don't get that? If the minister doesn't approve that?
They're expected to go home if they can, go back to their home country.
And if they can't go back to their home country?
I don't know. We have to ask the minister that. Many people can't go home to their home country.
Yes, that's what I'm thinking. Many of the people that you...
Yeah, well, the department might re-detain them and deport them for people who might not be able to... Some countries will not accept the nationals if they are removed and deported.
Yeah.
Deported is the right word, really. The department says remove. Some countries will not accept involuntary return.
Yeah.
Don't know.
So they're in limbo.
They're in limbo.
Yeah.
They're indefinite. Some could be, the department might detain people and keep them in detention indefinitely, or just leave you into the community for us to look after.
because there's no funding. So again, as you say, we're reliant on.
That's
they
right.
are reliant on the goodwill and the generosity
of donors.
Yeah, which
It's appalling.
it is appalling, absolutely appalling.
Yeah.
The in terms of again, just coming back to COVID and the impact that's had, how has that impacted on people's application forms? So we know that, you're saying no food, no money, they're relying again on the generosity of donors and that kind of stuff, but what about their actual applications? Is that slowing down? Has that been affected?
Well, as far as we know, the department is still operating,
Okay.
albeit from home perhaps.
Yeah.
But the department hasn't stopped
Okay.
assessing people's applications.
Yeah.
I mean, the courts are still sitting,
Okay.
maybe not as frequently, and it's all remotely, which is so difficult when you have his honor, her honor, and then the client, maybe a support person, an interpreter, maybe or maybe not a legal representative.
Yeah.
Yeah, it's
Yeah.
difficult all round.
Absolutely.
The extra stress, yeah.
And have you seen an increase in people coming to the hub looking for food?
Definitely. I think yesterday, which was Thursday, 35 people, majority for emergency relief. But even if they come up for migration support, they'll always go down and get food anyway. Yeah. So families and individuals across the world, really, we're a mini UN, Indophili, Afghanistan, Iran, Iraq, Burma, Sri Lanka, all the refugee-producing countries. Some are hosting countries too.
And just for people to understand, so the IUC hub is only open on
Thursday and Saturday afternoons. It's only the church part of it because of COVID. There's no services or anything. We remain open because we're an essential service, but we meet all the health guidelines. We wipe surfaces down. With contact tracing, we take people's names, phone numbers, that kind of stuff, hand sanitizer, and triage people. If they come for food, they just take from the car park and they go off.
Absolutely.
And the number of people is monitored as well.
Yeah. So that's for the legacy people that you're talking about.
Offshore people.
What about the offshore?
Before we go to the onshore people, those who've got 3 and 5 year visas as well, they they can apply for special benefits, Centrelink benefits.
Okay.
And they might not know how to do that, so we can kind of refer them to another agency. Sometimes we kind of help them to do that. People's Medicare cards are expired, they need help to renew, so we kind of do that as well.
Right, okay.
So the people on 3 and 5 year visas who don't have jobs are slightly little better off than the people who don't have a substantive visa, a 3 or 5 year visa.
Do we have many people who don't have?
We have more people who don't have a visa than
that do.
Than people who have a visa.
Right.
Because the ones who have a visa don't necessarily come to IUC.
No, of course not.
I mean, they will come if they kind of need to reapply. So after your 3 year visa expires, you'll need to reapply. And that's the problem with temporary visas. How can you tell a refugee, I recognize you're a refugee, but you're only going to get a temporary visa? You have to reapply in 3 years or 5 years. People can't settle. There's no family reunion under a temporary visa. It's really hard.
Absolutely. And then they're consistently having to reprove that they're refugees.
Yeah, they're stressed. They're stressed about it. That's right. Yeah. And, so we had temporary protection visas before, and then that was repealed because that's just not recommended for the refugee space. And then under this government, it's been reinstated, temporary protection visas.
Which doesn't allow the person, as you say, to settle.
You can't settle.
To become an actual citizen.
Yeah, I mean, you don't have permanent residence, so you can't even get permanent residency, which means you can't even bring your family.
No.
So there's no family reunion.
No.
So it's a dud visa. It's a bad visa.
And in fact, one could argue that it does create so much more emotional, psychological harm and trauma to the people.
People are a bit anxious about what will happen. I mean, they're relieved they've got a visa.
Yes.
Yeah, they've got, which will allow them to work and study, that kind of thing. But they're also stressed about the reassessment. Yeah. What will happen then? Yeah.
Absolutely.
Yeah. So that's a bad policy.
Okay, that point is taken and made.
Thank you.
What about the offshore? What's happening for them at the moment?
Yeah, so we started sending people to Nauru and Papua New Guinea. If you arrive by boat after July 2015, you're at Christmas Island, And yeah, we're not sure how the process is. You go, you stay. You stay meaning you can stay in Australia. You still have to apply, but some people were shipped offshore, and then others, who arrived on the same boat were not sent to Nauru in Papua New Guinea. So we're not sure how that all worked. One day we'll ask that question.
So people have had different outcomes depending
Absolutely. Yeah, you can have 30 people on the same boat who arrived at the same time. 5 families go to Nauru. 15 individuals, men, will go to Manus Island, Papua New Guinea, and then the rest would come to Australia and then put their application. It doesn't make sense. So the selection process would be interesting to explore one day.
Yes.
So we had 1,500 men to Papua New Guinea, and mainly families to Nauru, and some single people. I don't know the numbers because I've never been to Nauru. So there's a whole heap of stuff that's going on in Manus, which we can talk about in future episodes.
Yes.
The main point for this particular conversation now we're having is the Medevac legislation, which was passed by with the help of the Labour government and independents and Greens, that kind of thing, recognising that people in Nauru and Manus Island and in Port Moresby were not getting adequate and timely health care. So the Medevac legislation passed in March 2019.
19, yes.
Yes, and then we had people coming. So we talk about the medical evacuees under Medevac. They come to Brisbane was the first port of call because of the flights, I suppose. We're closer to PNG and Nauru.
Uh-huh.
A couple of people who were really sick went to Cairns first, and then kind of made the onward journey to Brisbane. So they were, put into the BITA. That's our Brisbane Immigration Transit Accommodation. That's our Immigration Detention Centre in 100 Sugar Mill Road, Pinken Bar, which is near the airport. If people don't know that we have an Immigration Detention Centre.
I was going to say, I would imagine that not many people.
Yes, not many people would know. So it's near the airport for obvious reasons. Airport turnarounds and all that kind of stuff. So as people were coming under Medevac, they were placed at the BITA, and as the BITA became quite full, they contracted a hotel in Main Road, Kangaroo Point, which is called an APOD, an Alternative Place of Detention, APOD, which is a hotel.
Yep.
And so there are, at this point of time, maybe between 110 to 115 men. The numbers keep changing at the APOD in Kangaroo Point.
And are they all isolated? Are they all in their own individual rooms, or are they?
2 people are sharing rooms.
Okay.
And then I think there's some individual rooms as well.
And was that developed because of COVID, or was that just because VITA was getting?
Yeah, VITA was getting full. So there were people in the airport before COVID, and then as COVID hit, more people were sent from the VITA because at the VITA you've got 2 bunk beds in one room, so 4 people. Very, very small room.
So it's like a prison. It is a prison.
Yes. The conditions are quite prison-like, yes, because in immigration detention, you're actually worse off than a prisoner because you don't have an end date. You don't have a date of release.
Of course.
In prison, you have a date of release or date of parole.
Yes.
You kind of committed a crime. You know why you're there. You know why you're in there.
You do the time and then you get.
That's right.
Yeah.
Yeah. In immigration detention, especially for these men who are Medevac, they still can't work out why they're still locked up.
Yes.
So people have been locked up for more than 1 year. And I guess the healthcare is also questionable, whether people are getting adequate, timely healthcare. What does that look like? They are being treated like public health patients, so you just wait like every other Australian waits for your surgery or your appointments. For some people, because the average Australian has to wait, so you wait as well. That's what is told to them.
So just to understand, so if someone has got a medical condition that was so urgent that they needed to be medevaced back here to Australia, they're here but they're waiting.
They're still waiting, yeah. So not everyone has had timely treatment. Dental issues is a big issue as well. A lot of people have got very severe dental problems.
Okay.
Because, in Nauru and PNG, you get very limited, if at all, dental care. So people have lost teeth, which then causes digestion problems and then stomach problems.
Yes.
Some people need dentures because they've got no teeth to chew their food properly. But under the contract, the IHMS, which is the health provider, National Health and Medical Service, I think they're contracted to provide 2 procedures for dental, and that's an extraction or a filling. And that's all you get. So you don't get any dentures or anything like that. So that's a big problem for dental care, and then there's a whole heap of other medical conditions.
That's just appalling.
It is. And being locked up, obviously has worsened people's mental health.
Absolutely, yes.
And we've also, I guess, seen some medical notes of the men's
Yes.
that actually says there's nothing more I can do for you treatment-wise. It's a physical condition, isn't it? Your detention is causing you the mental stress and harm.
Yes, of course.
And of course we know that.
Yeah.
Yeah. So it really doesn't make sense.
No.
We've been calling for safer options, i.e. community detention. So moving the men from locked detention into the community. Don't forget, some men have got immediate family members, like a wife and children. And some of them have other family members, like cousins and brothers and sisters and uncles and aunties in Australia.
Here in our community.
Across Australia. So it really doesn't make sense why you would not reunite families where it's possible to reunite. There's no other character issue or something. I mean, people have asked me this question all the time. Are they terrorists? Are they dangerous? Well, at the end of the day, they came under Medivac. Pete Dutton had the final say.
Yes.
To check people's backgrounds anyway. So anyone who's here has been character checked.
Which means they would not be dangerous.
If they're a threat to the community, the minister needs to tell them, I'm not releasing you because you're a threat to the community and this is my evidence.
Yes, but we don't have that information.
We don't have that. And they don't have that. They don't even know. They keep asking us, why are we still being locked up? What have I done? I'm not a criminal.
You were talking about the impact on mental health, and particularly now also with COVID as well. So they're locked away. For many of these people these individuals, they haven't received the full medical care that they need yet, or they've received all they're going to get, which would then, of course, continue to impact on someone's emotional well-being, wouldn't it?
Yes, of course. And they're so sick now. This is entering from July this year, which is next month. It will be the 8th year, entering the 8th year of detention. Now, of course, on a radio program, Minister Alan Tudge says that they were not detained when they were in Nauru and PNG. They were free to move. Okay, some people may have had the freedom to move, but you still had inadequate health care.
Yes.
You still had no hope of resettlement. PNG and Nauru are not resettlement countries as flagged by the UN in multiple reports. And you didn't really have the freedom to kind of leave the country and go, where would you go?
Yes.
So that's also a bit of a misinformation, because on a program he kind of said since 2015 no one's been in detention.
Well, that's a lie, isn't it?
That's right. That's not true.
Yes.
And, it made it sound as if it's kind of paradise in PNG and Nauru. I mean, might be paradise for the locals living there, but
not
when you've been detained for so many years already and you don't know about your resettlement options. Not everyone's going to the US.
Yes.
Some people who've been accepted have gone, others are still waiting. Many have not been accepted, and they still don't know what plan B, plan C would be.
Yeah. Yeah.
So we kind of need people out of locked detention into safer options, which is community detention. And, confinement under COVID can't be safe.
No.
So visits have stopped. We haven't been able to visit the men since March, I think, for about 3 to 4 months. It's as if we were going to bring COVID in and affect the men. I mean, there's heaps of security staff there.
Yeah. It's
only recently that they've had temperature checks and all that.
Oh, really?
Yeah. Prior to that, there were no temperature checks. There was staff moving in and out. So who's going to affect who?
No, absolutely. And I mean, everything that you're saying just, to me, indicates kind of layer upon layer of trauma and distress for these individuals. And there's been a lot of demonstrations.
Yes, there's been protests. I guess the community is now kind of aware of what's happening. And it's raised awareness.
Yeah.
I think, there's been some comments that the men can't be sick because they're standing on the veranda with placards. Well, that's also, it's really weird what people say. You can still have lots of physical and mental health issues. You're not comatose in bed and stand there with a placard. It doesn't mean you're not sick. So it's really quite bizarre. Yeah, but that's what we've kind of read as well. So the Kangaroo Point residents, majority of the residents, or many of the residents I've spoken with, are very supportive about, the men being out into the community where there are safer options for them. And they'll have time to kind of recover from their mental health. I mean, I don't know how you recover. Some men will do better than others.
Yes.
And I think it's just having the freedom to kind of walk around and go to the supermarket, cook your own meals. People want to cook their own meals.
Really?
Yes, they do, because, of their stomach problems too. They want to eat smaller, more frequent meals. They want to eat their own food.
So they can't do that at the moment?
No, they can't do that. Everything's kind of catered. So other people say, oh, well, they've got a room and they've got food. They should be okay. Why are they grumbling? Well, yeah, I know.
And there's no freedom. There's no choice.
That's right.
Absolutely no freedom or choice. I know we're coming to the end of our time, but I'm curious the cost that this would be for the men to be kept in a hotel as opposed to being able to go into the community with family and loved ones.
Given there's a budget deficit because of the bushfires and COVID, and the figures we have is $350,000 a year to keep a person in detention, in immigration detention, whether it's the Biter or the Airport Kangaroo Point. It's $100,000 a year to keep someone in community detention. So that's third quarter. And then it's, a lot cheaper to allow somebody on a bridging visa into the community. But a lot of the men are too sick to be out on a bridging visa because the bridging visa comes with work rights, no government support, nothing. A lot of the men are too sick. So the safest option for them really, for majority of the men, would be in community detention. Many of the men have letters of support from their friends who've known them from a long time, and community supporting. Some people have offered accommodation to the men.
How generous.
Yes, and the letters of support are with the department, so the department knows who these men are. And then others have provided letters of support. When you're in the community, I will provide the practical support, help you go to medical appointments, take you to the dentist, that kind of thing. They're service providers, but they have a very small, window, and their contracts are very, they're not contracted to provide a lot of service.
But it sounds like there's a community of people who are willing to support these individuals, that if they're in the community themselves, then their overall health and well-being, their mental health would improve because they would have a support network around them.
Absolutely. We've mobilized the community, faith-based and non-faith-based people.
Yeah.
We're just kind of waiting for people to be able to be out from the locked detention into the community, and then after that kind of work out what's resettlement or where people will be. Right now it's a mental health crisis. Right now it's just we need to get the men out.
Absolutely. Yeah. Absolutely. And if we don't do that, then we are going to see a complete deterioration in terms of increases in self-harm.
God forbid if we have another death in custody. We've had 3 deaths in custody offshore already from Nauru and PNG, and
Absolutely. And something that we need to all take responsibility for as citizens of this country.
Yes.
Right. Thank you so much, Rebecca. I think that's probably a very sobering place to leave our second conversation, and look forward to our next conversation. Thank you.
Thank you, Fatina.